I'm Dee.
I'm Will.
We're the Simple Complex Men. We're so excited to be back again today. We have something a little bit new, which me and Brother Will are excited about. We have a new topic that we will be kind of adding to our platform, and it will be on health. And the title of it is Be in Good Health, because we believe that God does not only want us to be in good spiritual health, but he wants us also to take care of our body, because that's his temple, so we can be in good natural health.
Yes, we have Dr. Lewis, and it's an honor and a pleasure to have this brother on to speak to the fellas and just anyone who in general want to get some good ideas and concepts, no pun intended, on how to really take care of their temples, because we know that the Bible says that we are the temple of the living God. And so just a little bit of background about Dr. Lewis. Dr. Lewis completed his bachelor's degree in exercise science at St. Augustine's University in Raleigh, North Carolina. He attended Life University and received his doctoral degree in chiropractic care December 2008. Dr. Lewis puts more emphasis on helping patients to restore their full quality of health from a chiropractic and nutritional standpoint. He is certified to perform a procedure called manipulation under anesthesia to restore spinal neurological dysfunction and extremity flexibility. His mission is to allow God to use his gifts, talents, and abilities to help others increase the quality of their lives spiritually and naturally. Amen. Thank God for that. Amen.
Well, how you doing, Dr. Lewis?
I'm doing well. How about you?
We're well. We're doing great.
That's good.
Yeah, we're so excited to have you on Simple Complex Men. I know with Brother Will. I'm so excited just to kind of see you. For those who don't know, this is a long-term, relationship, probably over 15 years, I'm sure. So
exactly,
definitely know this brother. So we're excited to be able to get some good information as it relates to our bodies from Dr. Lewis today. So we're just going to kind of jump right into it. How you been doing, Dr. Lewis? I know in light of the pandemic and everything, last couple of years, it's been pretty trying for everyone. How's it been going for you?
It's been going good. I just been staying focused on doing some things to actually boost my immune system since the pandemic. Just taking my vitamins, increasing my workout frequency, and making sure I'm eating right. So that's what's pretty much keeping me going. And also, most importantly, just keeping my stress levels low, just through prayer, still, listening and studying the word of God.
Wonderful. Now, let me ask you, did it impact any way as far as your establishment or anything during this time? How were you all able to, just from a business standpoint, kind of fare through the pandemic?
It impacted slightly. We were a little slow, especially when everything had shut down. But that only lasts for maybe 5 or 6 weeks, and then things started to pick back up.
Okay.
Right, because fortunately, I'm in a position where we have people, they're looking for different ways or different alternatives to actually increase their health, especially with this pandemic.
Oh, and Dr. Lewis, you had mentioned that you were taking vitamins. For those who may be a little curious, do you mind sharing what particular vitamins you were taking and what may be the medical benefits of those vitamins?
Yes, of course. I've been taking vitamin D, vitamin C, which will help boost the immune system. Also take this supplement called Spirulina. Spirulina is a good source of all the nutrients we need, all the antioxidants we need, that is pretty much, as of right now, is one of the best supplements on the planet. It's all natural, nothing is man-made in this particular product. And that will give us a variety of benefits. Not only that, it will help boost the immune system, it will also help decrease our blood pressure, blood sugar, cholesterol. Also, it will help boost our energy levels, give us the right protein that we need. And especially if we are active, it will also help, increase our endurance and build our muscle strength.
Okay, where could we might readily find spirulina, like over the counter? Because I did like a little bit of search on it. What would it be? Do you recommend like taking spirulina like orally, like the actual plant, or like supplement pill form?
Capsule form, or
it comes in a powder form, which is better because the capsule, it takes time for the body to break it down.
the absorption.
It comes in a powder form. You can find it at a Whole Food store, or you can actually find it on Amazon.
Okay.
Awesome.
And you need about at least a teaspoon of it. The daily dosage, at least between 7 or 10 grams to get all the benefits you need. Just once a day in the morning.
Okay.
Awesome.
And you can mix it up with at least 8 or 16 ounces of water. You can put it in a smoothie, and it doesn't take long for you to actually feel the benefits you're looking for.
Wow.
That's amazing. I'm glad to hear that, Dr. Lewis. Because I'm into a lot of naturopathic, herb supplement, things like that as well.
Exactly.
And so I like to hear that you actually sounds like you support the herbal medicines and things as well.
Yes.
Wonderful one. Have you heard of moringa? That's something I just kind of got into. I was hearing good things about that as well. All the wonderful benefits, and I think it had all the amino acids and things that your body needs and stuff.
Yes. Yes.
Also
Moringa.
Yeah.
Yes. Moringa is another nutrient or supplement that is known for giving us the antioxidants we need. Because as we get older as men, our bodies or our cells become more oxidized, and that will produce free radicals, which causes cancer, prostate cancer, colon cancer. So that's very important. That with this spirulina, that's very important to fight off those free radicals, and also to give us the energy that we need. Because as soon as we get into our 40s, we will notice that our energy level begins to decline. We're not going to feel as motivated as we used to go to the gym, to do like particular workout routines, so that will definitely help give us the stamina that we need.
Yeah. And I feel sorry. And that's what I always tell, Brother Will, now that, he's above 40, I don't know what y'all talking. that definitely didn't apply to me, but I definitely understand when I get there, at least I got some information that I can work with. So I appreciate that, Dr. Lewis.
Anytime.
Now, again, do you recommend powder form for moringa?
Yes.
Okay.
I recommend powder form for moringa, spirulina. Most of the supplements I recommend powder form because that will actually begin to break down a lot faster in our bodies versus taking a capsule. Now, there are some stuff out there, like for example, like vitamin D, vitamin C. It's only going to come in a capsule form. Taking like omega-3s, that's going to come in a capsule. Because they don't. With that particular supplement or vitamin, there's no other way to actually form it, especially with the omega-3, with the omega-3, you don't want to take the oil base because a lot of people, it don't really taste right. Yeah. But if you take the omega-3 capsule, you can immediately swallow it. You don't have to worry about tasting anything. And then it will start, breaking down our bodies.
What, Dr. Lewis, what do you think, piggyback in terms of the vitamin D, which vitamin, because I know when I first started getting into it, the whole D's and, is it D3 or, that type of thing. But also, what do you think about the tinctures in liquid form as well? Do you think that's even better than capsule, or do you still believe that capsule is better?
Good question. It depends on the individual,
Okay.
Some people, they may have some digestive issues and they may just have to take the liquid form, like for example, I take garlic as well, and I take the capsule form of garlic. Now they do have the liquid form. They have like the garlic, herbal tea, and the capsule is becoming more popular with the garlic because the way they make it now is they have it in a way where they can eliminate the smell of the garlic. Okay. But it also, to piggyback on your question, it also depends on the individual. Some people, they may have some digestive problems and they cannot swallow the capsule, so they will prefer the liquid form.
Awesome. Wow, we're getting into the thick of things here. I'm getting excited. I'm getting excited, Dr. Lewis.
Yeah, just to
hear that. Just to hear the information. Because I definitely got other questions, whether it's the turmerics, Irish sea moss, all that type of stuff. So we're gonna definitely jump in there. Let's back it up just a little bit, Brother Will. Let's talk a little bit about how did you get into or get on this path or this journey to chiropractic care as well as nutrition. Now I was kind of, we go back some years. So I can remember, when you even started and you were kind of college or telling me that you were leaving, so I'm like, no, my friend is leaving. So, so I even remember that. And so let's just kind of share with the audience your journey and how you got to this point.
It all started with my family history. Most of my family members, they passed away from natural causes. I can remember verbatim seeing them in a hospital or at home on a sick bed, taking all sorts of medications to try to survive. And, especially most of the males in my family, it started with my dad. My dad passed away in 97. He was only 50 years old. And I can remember he was the one who got me into the holistic side of health because, he had a hard time getting his blood pressure down. And not only that, the doctor had him on blood pressure medications, but he was also taking the garlic. He was taking the garlic, the herbal teas. And so by watching him going through that, he was also teaching me the different ways to take care of ourselves. So we wanted to go through any surgery, anything invasive, or taking a lot of medications. And I can just remember, my grandparents, they also suffer with, issues with hypertension, strokes. My grandmother, she passed away from pancreatic cancer. So that really motivated me to get into something that's more holistic, so that we will reap the benefit taking the most of the natural supplements, the capsules, herbs and stuff. And if you think about it, it can also have an impact financially. If we don't take care of ourselves, we're going to find ourselves just, spending tons of money on all these medications. Yeah. And if you have done your research recently, right now, there's a opioid crisis. There are people who are addicted to those opioids. Yeah. They are very strong, addictive. I went to a seminar last week, and one of the doctors, he discussed how he got into the chiropractic profession because his nephew, who was on a baseball scholarship, hurt himself on the team. His mother took him to the orthopedic doctor. The orthopedic doctor prescribed him opioids. He became addicted to that stuff, and they graduated from taking opioids to heroin. Wow. So it's out there. Are people out there who are addicted to that stuff, and they're just taking it when their body just don't need it anymore because that's how strong it is. But it comes from that, my upbringing, the things that I've seen in my family. I've also been active all my life playing sports, and just going through the chiropractic treatments myself, I've also noticed the benefit for me is, as far as my performance. I like to swim. So I notice when I get adjusted, I notice that my flexibility and range of motion has improved, and also my stamina.
Wow, that's awesome. And real quick, because I know Brother Will might have a question as well. What's your thoughts on because in we talk a little bit, online. So I'm going through some health challenges past 6 years, And so I had an opportunity to really go through maybe every type of doctor or specialist on the planet at this point, every ologist you could think of. And one thing I learned in that journey is the kind of the differences of specialties. I noticed, and you can kind of speak to this, Dr. Lewis, the functional medicine coming to the forefront. Can you talk a little bit about that? Because I know you may have chiropractors, but now I actually went to a functional chiropractor, and then you have functional, different doctors who are in that
Yes.
area.
Yes. And that's, to me, that is one of the best avenues to go into, functional or integrated medicine.
What's the difference? How does
the difference? Just chiropractic alone, you don't pretty much get all the necessary tools you need to get better, because there are some conditions that we may have that requires more than just chiropractic care. For example, I practice in Atlanta. In my office, not only that we have a chiropractic team, we also have a medical team. We also have a physical therapy team. I look at the patient's MRI. If the MRI is positive, I refer them out to the spine specialist. If there is no improvement when they go see the spine specialist, also do this procedure called manipulation under anesthesia, which is a very, very less invasive procedure besides surgery that will help break up the scar tissue that develops when the body is trying to heal. So this gives the patient an opportunity to experience all of the necessary tools that we have than just sticking to one particular specialty. Now, if your injuries, for example, are acute or is pretty new, okay, you may benefit from just chiropractic care alone because the injury just happened. But if it's chronic, it's been there for several months, years, then you may have to go through multiple avenues.
Okay.
Awesome.
And Dr. Lewis, you mentioned, because some people may not know what a chiropractor is. I mean, I know my knowledge of it may be very limited within itself, because when I think of a chiropractor, I think, oh, that's someone you go to when you're having back pains or you can't sit properly, but that's pretty much where I end. So what does a chiropractor do? And you kind of gave us a detail that it's just more than looking at your back, but from your expertise, what is a chiropractor?
All right, let's break this down. Okay, so you have chiropractic. Now, the Greek word in that word chiropractic, chiro means hands. The rest of it, practice, okay? So it's a holistic approach to eliminating back pain or helping someone get to a level of optimal health by using our hands. We pretty much focus more on the nervous system, okay? Because the spine is like the headquarters for the nervous system, okay? If you Google or pull up the model of the spine, you will see these nerves branching out of the spine. The nerves are actually very long, okay? And when they branch out from the spine, it connects to all of the organs in our body, all right? So when we produce that chiropractic adjustment or give that chiropractic adjustment, it's not just getting the person out of back pain, but it's also helping them reach their optimal level of health, and also helping them increase their quality of life, so that they could be able to walk, stand, sit for long periods of time without any issues. They're able to perform a certain athletic activity without experiencing any stiffness or notice a compromise or sort of a glitch in their performance. That's what it's all about, And there is some research out there that talks about how people, especially with health challenges such as hypertension, heart problems, they also benefit from that as well. But everything has to work together, as I was talking about, as I mentioned before, about integrated health. Okay. Yeah. Not only that they have to go see a chiropractor, but nutrition plays a whole big role in that as well. Okay. We can get an adjustment. All right. We can be feeling fine. But if we are consuming things that are not good for us, what's going to happen is that our body is going to accumulate toxins from food. Those toxins will also cause us to have some back pain or discomfort.
Wow.
Wow.
So how does that I had no idea that the food that we eat can play a role in us developing back issues, in which you said in turn can manifest themselves as nerve issues, or somebody like, oh, I feel like my back is pinching or something like that.
Mhm.
So what kind of foods then should we maybe stay away from, or beverages as well, or eat or consume in moderation?
All right, let's start off with the beverages. We have to stay away from caffeine. Caffeine dehydrates. Caffeine, even tobacco, it dehydrates the spine. They are discs or cushions in between the spine. Those discs contain 75–80% water. Caffeine can dry that out, which will lead to back pain. Okay.
Wow.
Soft drinks, okay, same thing, can also prevent us from staying hydrated. The sugar in those soft drinks, the sugar molecules are very large. When those sugar molecules, or glucose molecules, begins to contact the nerves in our spine, that can cause pain. Now, if our metabolism is running rapid, we may be fine. But as we get older, our body does not metabolize those glucose molecules. Okay. So what does the body do? Stores it as fat, right? Not only that it will store it as fat, eventually our body's insulin levels will run out. And then we get all these glucose molecules in our bloodstream. That's going to cause a whole lot of problems. Of course, you know what I'm leading to, type 2 diabetes. Okay.
Yeah.
As far as food, we have to eliminate eating a lot or consuming a lot of meat, because meat will cause inflammation in our body. Okay. Inflammation or swelling, once again, can also aggravate the nerves in our body, leading to pain.
Awesome. Let me ask you, Dr. Lewis, on that point of the inflammation, because we know, the body's, as far as mechanisms, they have mechanisms in us. And since this is a spiritual platform, God has made our body a certain way. And so we do have protective mechanisms.
Mhm.
Now, I know inflammation plays a point or a part in our body. So are you talking about just having zero inflammation or chronic inflammation as far as in our body?
Good question. Inflammation can start off as its beginning stages. Okay. Now, going back to when we were young, our bodies are able to metabolize it, flush it out. Okay. As we get older, once again, we become more prone to inflammation. Okay. Which will lead to a whole lot of problems. I just found out at the seminar I went to last weekend that it's not just a lot of wear and tear on our bodies that will cause our joints and cartilage or ligaments to wear down. It's the inflammation. It's the inflammation that will weaken the tendons, weaken the cartilage, weaken the ligaments. And then when we start to do something that's more strange to our bodies, that will cause us to become more prone to injury. And all this just comes from what we eat. What we eat, lifestyle habits, all of that will come from that.
Wow. Well, I know a lot of people, and I know I've started getting into, and you can talk to this, Dr. Lewis, in reference to some of the natural things that we can do as far as turmeric.
Yes.
And the power of that, as well as I know moringa it was classified as one of the anti-inflammatories as well. But can you talk a little bit about the turmeric, but also, of course, we have the Western medicine and things they have from that perspective, those two, and what's the pros and cons in terms of trying to tackle this inflammation within our bodies?
Turmeric, let's start off with the cons with that. The toughest part about turmeric is that it comes in a variety of forms. You got the capsule, you got the powder form, You have the liquid form, you know. So the question is, okay, which one should I go for? You know, me personally, like I said, I prefer the powder because it's more convenient. You know, I put the turmeric in my water, my tea, and then I go from there. I noticed now that I'm sure you all probably noticed this, that now they have turmeric on cereal.
Yeah,
Okay, so you know they have the
just
turmeric
started buying that
capsules.
too.
Right, right. So it's becoming more popular. The pros with that is that, like I said, it's a natural anti-inflammatory, and it does work. But it's all about how we use it, figuring out which form of it works for us. So it's a whole lot of benefits to that. It's pretty good, but just trying to figure out which direction should I go for. Should I go for the capsules, the powder, the liquid, eating the cereal?
Yeah.
It's a, you know, you have to try to like make those adjustments to figure out what works for you.
Awesome.
Yep.
That's good. So could you elaborate a little bit on your nutritional training? Because I've been made aware that a little of no nutritional training is offered to anyone, to doctors. So is there any truth or any validity in that, as well as how did you kind of bridge the gap in a way to where you are very privy of that knowledge, of that information, of what natural health plays in our lives?
Okay, so you want to know how did I end up getting into that?
Yeah.
Okay. I started off taking small steps, you know, to be transparent, you know, when I was in my teens, 20s, and also early 30s, my mentality was, as long as I work out, stay active, I can eat anything I want and I'll be fine. Okay. Now, the truth was to that, it did work at the beginning when I was younger. You know, I'll go to the doctor, get a physical, and all my numbers will still be picture perfect. Okay. But as soon as I got into my late 20s and 30s, I was still active. But when I would go to the doctor to get a checkup, my numbers were off. So that's when the light bulb came on my head. Okay, I need to start working on my diet. I need to start working on what I put in. So that's when I started doing my research, and I just pretty much figured out that, okay, 80% of the results we are looking for comes from nutrition. The 20% comes from staying active. Okay. Food is medicine. All right. So when I figured that out, that's when I began to slowly taper off. I began to taper off from the amount of sugar I was putting in my body. I began to cut back on my portions of meat. Even got to the point, and it's been 4 years now, that I got involved in the plant-based diet. Okay. And that came about, you know, every year my church does a Holy Week fast. And during that Holy Week fast, we can't consume any meat. It's all raw vegetables, no juice, no caffeine, you know, raw vegetables and water. I was noticing the benefits from that. I was coming down to my ideal weight. My energy levels had boosted. Like I said earlier, I like to swim. I was beginning to swim more laps than I could do before. So I said, you know what? I'm going to stick with this diet here. You know, now I didn't want to lose too much weight. So I had to, you know, gain knowledge on how I can get my protein from other sources besides meat.
Yeah.
You know, so I was able to get my protein from fish. Salmon is good for us because with salmon, we can consume the omega-3s that we need, which is good for our heart and our blood pressure, circulatory system. Okay. But at the same time, we can also consume the right amount of protein that we need. But so ever since then, I've been sticking with that plant-based diet, you know, and also prior to that, I was having a lot of allergic reactions to dairy. So I had to cut back on not only the sugar, but also the milk, the butter, the cheese, because that would cause me to have some some lung congestions in my lungs. So I had to cut back on that. And things been fine since then.
Wow. Yeah, Dr. Lewis, I'm glad you mentioned that, even talking about dairy, because, you know, I think I had to switch. I think I was in my 20s when I discovered that I was lactose intolerant. I know they said for a lot of African Americans, predominantly, a lot of us are lactose intolerant. And of course, you know, I went on the journey of, okay, I'm switching to skim milk. I'm switching to 2%. Of course, it's like the nastiest thing ever, you know, until eventually, you know, soy came on the scene. And I started hearing pros and cons of that and the estrogen and things for men. Then I switched over to almond, and then, you know, I do between almond and coconut, and now they have oat milk and things like that. But I kind of stay in the almond and coconut area. But
good. That's good.
yeah. Yeah. So what do you, I guess I wanted to also ask about calories. Now, I know we have a lot of people watching that might be calorie counters.
Right.
What do you think about that? Do you think it's necessary? I know you on a more plant-based. Do you think it's necessary to count calories, or do you count calories as far as, you know, the nutritional system that you use for yourself? What do you think about that, Dr. Lewis?
Everyone is different. Now, I work out 3 times a week, okay? Monday, Wednesday, and Friday. On the days that I don't work out, that's when I count my calories, okay? So it's not good to work out back to back. You need your body some time to heal before you get back to your workout routine. So while you're having your day of rest, then you want to concentrate on the calories you put in. You want to concentrate more on nutrition, okay? Now, the days that you are getting to your exercise routine, okay, you need your calories, because your calories is fuel for whatever type of workout you're going to do. You're going to do some endurance training, some cardio, okay, you need your calories for that, because that will add fuel to the muscles to get through your workout routine, right? You know, so, but we have to be mindful of where we are getting our calories from. Okay, we get our calories from a lot of junk food, you know, sweets. Those are just like our simple carbs or simple calories that will just give us a spike of energy that will only last for a short period of time, and then it will take a deep down spiral. Okay, so we want to get the calories that we need from good, healthy sources. Okay. So we can have that steady plateau of energy. Okay. So it's all about planning the type of workout that you do. A lot of marathon runners, when they're going through their training, they consume a lot of calories, a lot of carbs, because carbs will add fuel to their muscles to be able to go on a long journey when they're running.
Awesome.
That's good. That's good. So as a Christian man who happens to be a doctor, how does your faith play a role in your work, Dr. Lewis?
Good question. One of the spiritual principles that we've been taught is stewardship, you know, and in the Bible, it talks about how our bodies our bodies aren't ours. They also belong to the Lord's, and our bodies are considered as the Lord's temple, so that he can dwell in, you know, because God does his work through man. He does his work through people. Okay. So it's very important for us to take care of our bodies, because if we don't take care of our bodies, how are we going to carry out the assignment that God has for us? You know, sometimes God may give us multiple assignments. He may call us to work in multiple ministries. So we need that energy to be able to carry that out. Okay. Because if we're not functioning at our optimal level, it's going to be very difficult to do that. And there are going to be times that we can't work our ministry. We can't be a blessing to someone because we don't feel like we're in that condition to do it.
That's,
you know, so it's very.
How do you feel, you know, especially being a man of faith and a doctor, and everything. Do you feel any restraints from it, or do you feel pretty at liberty to be able to share your faith? Or how do you kind of maneuver, I guess, that fine line, you know, in your practice?
No, I don't feel restraints from it. I don't. Sometimes I do have the opportunity to share my faith. Every once in a while, I may get a patient who's going through a whole lot of stress because of the things that they're going through, and they give me the opportunity to share it. You know, because sharing my faith to me will help bring their stress levels down. Because whenever we're carrying a load of stress, that can also produce a lot of tension on our spine. Once again, leading to back pain, leading to headaches, especially tension headaches. You know, I deal with a lot of auto accident cases, and that can be very life-changing, life-altering.
Yeah.
So every once in a while, I have a patient come in very upset. Some of them will come in with a bad attitude, but I don't take it personal because I understand, okay, they just bought a vehicle. They get involved in an accident. Ever since they've been involved in an accident, they can't perform certain tasks that they are called to do in their job, and their supervisors all over them, you know? Yeah. So it's a whole lot of stress on them. They can't play with the kids as much as they used to. It's a lot going on. So that gives me an opportunity to share my faith and let them know that on the other side of the storm, there's a blessing. It's just a storm. It's temporary. It's not there to last.
Amen.
Amen.
Thank you for that.
Amen.
So to kind of segue back into that, because you had mentioned that you treat people that were in a lot of automobile accidents. So besides that, what are some of the most common issues you typically deal with in your profession?
I deal with a lot of like neurological issues, from herniated, as well to herniated bulging disc. Also some shoulder injuries, and you know, it depends on the mechanism of injury. Someone gets rear-ended pretty hard by 18-wheeler, or someone speeding and hit the back of their car. That can cause those discs to move out of place, create pressure in that nerve, and then it begins to start or initiate their back pain, neck pain, headaches.
Wow. I'm glad you mentioned that. I wanted to kind of go back to something you mentioned earlier when you were talking about the central nervous system and the importance of the spine. And of course, as you know, I've corresponded with you in reference to, you know, my process I've been going through with the back and everything. And so it's interesting. And I actually got a chart, and it's probably from a chiropractor from several years back. But the chart actually shows all the, you know, the C's and the lumbar and the different sections of the spine, but then it shows the branches, kind of branches off. And then it'll say like headache. It'll say, you know, back, this could be cause allergies or whatever.
Yes.
Can you talk a little bit about that? How advanced and important that spine is, and how it really can impact you? Because sometimes we don't connect maybe our allergies to a spinal issue or things like that. We may think it's something else.
That goes back to that immune system. Remember I mentioned earlier that you Google a picture of the spine and nervous system, you will see the nerves wrenching out from the spinal cord, from the spine, that connects to all the organs and stuff. Okay, especially at the upper portion of our neck, bottom portion of our neck. If there's some type of area that's compromised, that can cause allergies, especially some sinus problems there, because there's a lot of neurological components around our neck area that controls our sinuses. So if there's any type of misalignments or compromise in the nervous system in that area, that can lead to allergies. It can also lead to headaches as well. Okay, so there are so many benefits of chiropractic, because, like I said, it's not just about eliminating back pain, but we also help to relieve allergies, headaches. I worked on migraines. I worked on people who had vertigo or experienced dizziness. You know, because there's just so many techniques in the chiropractic profession that I can bring to the table.
Wow. That's amazing. Well, yeah, we definitely, Dr. Lewis, gonna have to have you back, because I mean, you've given us some really, really good information. And we're hoping everyone that's watching is really enjoying this and be able to get some free consultation, so it's just, I know you saving on that, those co-pays, no joke. So you gotta get yourself a little information, it goes a long way, free consultation, right?
Thousands of dollars worth of advice.
Yeah. So no, that's awesome. Could you I know one of the things, and I was just kind of thinking, and I know we could kind of running on time, but with the whole pandemic, and I know I'm dealing with this, and maybe I can get that free consultation to save me some copay, but I know I did a lot of sitting, a lot of sedentary type of things, and I know a lot of people around the country with the pandemic has gone through that because we weren't out and about as much, and now we're doing a lot of work from home, remote. I know people are gradually going back, but still a lot of people are working from home. Can you speak to the impact of sitting too much and what that can do to your body? Definitely. And also what some tips that we can do as well to kind of combat that?
Oh, glad you asked. Our bodies are created for movement, not sitting for long periods of time, or and also standing. So when we sit for long periods of time, the joints, especially around our lower back, around our core, will begin to lock up, and then that's when we'll start having this back pain. Okay. Now, going back to the inflammation, as we get older, our bodies become more prone to inflammation. Versus when we're younger, it can't metabolize it or flush it out. So when we're sitting for long periods of time, that inflammation or swelling will build up, pressure will build up around the lower back and spinal area, causing that problem. So it's very vital for us to just get up and move around. Research says that we need at least 30 minutes a day to exercise. Okay. When we do that, that will help keep the joints mobile, so we won't have these issues. Also, the type of chair that we need plays a role in that as well. Okay. Having a good chair to sit in. Those chairs that are made out of the mesh material is also good. Okay. But if you're looking more of a economical way to get around that, you can get a towel, roll it real good, put it on the small of your back so you don't have that problem. But like I said, the key is movement. We have to move. Every once in a while, it's good to take a break, go for a walk, get a quick 30 workout in, and then, after that, get back to our routine. And I guarantee you, it'll make a huge difference.
So question, if someone, because I know on my job, I sit down a lot, I'm looking at cameras and things of that nature. So if I'm sitting down hypothetically for like an hour, how long should I be on my feet after that?
30 minutes. You want to get up, walk around, you want to stretch. You will find some good lower back stretches you can do that are very simple. So it's not about doing a lot of strenuous activities. A lot of people think that, okay, working out, I gotta hit the weights pretty hard. You don't necessarily do that unless your goal is to become a bodybuilder. But, just doing something simple, put in 30 minutes of movement. Also, drinking a lot of water, okay? Because don't forget, the disc in our spine needs 80% water. So we have to keep our cells hydrated. Okay? And then what you can put in our water, we'll put the turmeric in our water, and that will help eliminate the inflammation that's causing the pain.
So what's like because I've been hearing so many conflicting information on water intake. I've been hearing people say you have to drink your weight in water. So from your expertise, how do we calculate how much water we should be drinking?
Good question. Me personally, I don't do the math on that. I just make sure that I drink at least 8 glasses of water. Now, I don't necessarily have 8 glasses of water laying around across my desk. No, I don't do that. So I just, keep track of the amount of water I consume by, just having a gallon or 2 gallons of water with me, But you would know that your body is well hydrated by just pretty much looking at your urine. If your urine is clear, then yeah, you're getting the right amount of water that you consume. If your urine is dark, you're not getting enough water. Okay, so if we're consuming too much caffeine, not drinking enough water, drinking a lot of sodas, we go to the bathroom. If our urine is dark, we're pretty much dehydrated. Okay, so we have to consume plenty of water until we see that urine is clear. Also, we can do the skin test. Okay, so it's simple. We take our skin, pull it up like that. Okay, if it bounces back pretty fast, then yeah, we are getting enough water. But
Okay,
we pull our skin and it stays up for a while before it goes back to original form, we're not consuming enough water.
All right, brother Will, look a little dehydrated over there, brother.
I'm good, bro. You see
Are
this
you good? Okay, let me see. Okay.
Very good.
I heard a pop of your collar, but pop of your skin.
Yeah. And that's a good that was a good point about the hydration and the necessity for that. One of the things I've been doing, I didn't realize that coconut water, now this is a thing I really didn't like it initially, but once I started learning about it and I found a brand that is digestible or palatable to me, I started to drink it more often. But I didn't realize how much that's like one of the top ways to get rehab. I mean, other than Gatorade and some of the stuff like that, but as far as natural, is coconut water. What do you think about that, Dr. Lewis?
Coconut is good because coconut, almonds, also avocado, that will help us to consume the good sources of fat that we need. All right, the body needs fat, all right, but we have to just stay away from the bad fat that will cause plaque buildup in the arteries. Now, here's the tricky thing about those electrolyte drinks. We have to be aware of the amount of sugar in those drinks.
You mean Gatorade? Like Gatorade?
Yes.
Okay.
Gatorade. There are some coconut beverages out there that has a lot of sugar in it. Okay. And the sad part is they're in the healthy food aisle.
Yeah.
Okay. But what people fail to realize is that, okay, they're getting something or consuming something that they think is healthy, but they're not getting the results that they're looking for. Okay, I'm consuming this stuff, but my weight is not going down, my weight is going up. Exactly, because of the sugar. Okay, so we have to be very careful with the amount of sugar in the coconut water, also those granola bars as well. Anything over 10 grams of sugar in those granola bars is not good. It has to be at least 10 grams or less with at least 5 grams of fiber. Yeah. So we have to be very careful or mindful what we shop for in the healthy food section. We got to really take our time and read the label, because I've had a few allergic reactions because I failed to read what's in that stuff. Remember I told you, it's the dairy that will mess me up.
Yeah.
And there's been several times I will consume something in my body, have a reaction, and then when I read the label, I'll see it'll have some stuff that fall in the dairy category. Whey, milk. Yeah. I'm like, oh man, yeah. I'm in for it now.
I'm glad you mentioned that, Doctor. And I know we run it on time. I'm telling you, we're gonna have you. Are you coming back, Dr. Lewis?
I'm definitely coming back, and it's an honor for having me. So I'm giving everyone a free consultation.
Oh, okay. Hey, wonderful. We appreciate that. I wanted to get Dr. Lewis on recorded that he will come back. And so, but no, that I think that's really great. What you said. One of the things I wanted to quickly talk about, and we can kind of wrap up if Brother Will, if you don't have a question as well, is about oh man, I'll tell you so much, but I want to talk about posture a little bit. What is the importance of that? Because I know I've been dealing with that a lot. I've been bad, over the years, and my mother used to tell me, because playing the keyboard and piano, and I'm slouching over for hours, working on music, and I think in my latter years it kind of caught up with me, and so I've been doing the little neck exercises and all of these type of things. But could you speak a little bit about that, Dr. Lewis, about the importance of posture?
Yes, posture is very, very important, because whenever we get into a habit of sitting or standing in poor posture over a period of time, our body will notice a change. When it notices a change, it will produce, true story, it will produce extra amount of bone growth to compensate for that change in posture. Okay.
Wow.
And whenever we have poor posture, especially like this all the time at a computer or whatever we're doing, we work from home. Not only that, it will cause some discomfort on our back, but it can also affect our breathing. Because if you notice you sit straight, everything begins to open up. Lungs begin to open up. We can breathe better. Okay. All right. We can exhale, inhale better. But when we're like this for long periods of time, our lungs doesn't function at its full capacity the way it's designed to function. Yeah.
Wow.
So, especially with standing, and this pretty much plays a big role on kids. School is about to start pretty soon. Kids are going to school with these heavy backpacks, especially, you got kids with scoliosis. That can definitely produce problems down the road. Because whenever there's poor posture in our spine, it can cause a chain reaction. It goes from for example, the lower back leads to the hips, then it goes down to the knees, feet, and ankles. It's a chain reaction.
Wow.
Chain reaction. Yep.
Wow. And what about texting? I know text, what they call text neck, I guess is the saying now. Text neck, and and I'm not gonna lie, and it's funny because I have staff and stuff, and sometimes I'll see you look around the office, you see everybody looking down like this at their phone, and it's like but we don't realize what that could be doing to us in the long term. What is the long-term impact of that? I know you talked about possible, I guess, bone growth.
Bone growth and also change in structure of the spine. Okay. This is what I see all the time at work on the x-ray, especially when I look at the x-ray of someone's neck area, because they like this all the time texting. They at the computer like this all the time. Okay. Now, you see my pen, right? All right. Yeah. So the normal structure of the spine is supposed to have like a backwards C curvature like that. Okay. But when someone's like this all the time, their neck is like a reverse C. It's going that way. Okay. And that can lead to not only neck pain, but also can lead to some headaches. It can lead to some sinus difficulties, because you remember everything up here, all the neurological components up here control our sinuses.
Wow.
Yep.
Wow.
Yep.
Well, thank you.
We have to work on our posture.
Thank you, Dr. Lewis. Definitely appreciate it. And like I said, we we been here a while, so we want to you got to get back to the family. So, Brother Will, did you have anything you wanted to ask Dr. Lewis before we wrap up so we can get back to the family?
Yeah, I guess just one last question that was just talking about like oftentimes when I'm out, I may see some elderly senior citizens, like they'll literally be hunched over. So I'm like thinking to myself, like, I know they say that they call that what is scoliosis, I believe is the term.
Osteoporosis.
Yeah, osteoporosis. Like, where does that come from? And does posture play a role in that?
Posture plays a little role in that. When you talk about osteoporosis, it can be a lot of Caucasians have that issue. Okay. As they get older, they have a decrease in bone density. When there's a decrease in bone density, that'll cause the bones to break down, and it can lead to them having bad posture. They start humping over like that. Okay. Wow. Nutrition can play a role in that. Lifestyle changes. You go back, look at their history, you notice that they've been in the military, or they've been competitive athletes, all the banging, wear and tear on their body. Eventually, in the long run, that can cause some changes. But when you talk about osteoporosis, that's more of a change in the bone, their bone density. And the way to prevent that from happening is working out, doing more resisting training workouts, because the more we do some resistance training, like doing the workout bands, the weights, and consuming our vitamin C, calcium, and stuff like that, that will prevent that breakdown in the bone structure.
Okay.
Awesome.
And one last thing. I know a lot of people in their beds, they have back pains from their beds. So is there an ideal type of mattress that is good for your back versus others?
Yes. You got some people, they're gonna spend extra amount on those Sleep Number mattress, before they purchase it. The retail person at the store will have them get on the mattress to figure out what their actually sleep number is. Okay. And the way it works is that as long as that mattress begin to fill in the curvature of your spine, and you don't have any problems at all, you don't find yourself tossing and turning, that's your sleep number. Okay. Now, we don't want to spend extra money. Pretty much find a mattress that's not too firm, not too soft, somewhere in between. Okay. Because if you look at the structure of the spine, it has those curves. Okay. That's the way God created it, because those curves function as a shock absorption against gravity. Okay. But when we're laying down, either on our side or on our back, and actually those are the good postures I recommend for sleeping. Don't sleep on your stomach. When we sleep on our stomach, that will increase those curves on our lower back, neck area, and put more pressure on the nerve, causing some back and neck issues. But when we sleep on our side or on our back, it's very important for that mattress to fill in that curvature. And you would know you have a good mattress when you're not finding yourself tossing and turning in bed trying to get comfortable.
Yeah. Wow. Well, thank you so much, Dr. I'm telling you, Brother Will, I got so many more questions going through my mind, but I don't want to keep it here all night long.
That'll be a part two.
Yeah. So, but we just want to thank you, Dr. Lewis, just for joining us. It's definitely been a blessing. Do you have any parting words or anything for the listeners?
Yes. Once again, keep your stress levels low. I know we're in a pandemic, inflation that can cause stress and anxiety, leading to headaches, back pain, neck pain. Stay prayed up, stay in the Word of God. And also remember, the change we're looking for, 80% nutrition, the other 20% diet, working out.
Amen. Well, again, like you said, we definitely appreciate you joining us, Dr. Lewis. If you're trying to reach Dr. Lewis, we're going to put his information down in the description section. So if you need to kind of reach out, you're in the Atlanta area, I just kind of want to reach out to Dr. Lewis and get a consultation. And, you got some things going on you want him to look at. We'll definitely have that information available for you. And with the Simple Complex Men, we're going to see you on the next episode, and you all have a blessed day.
Amen.
Be blessed, everyone.
You too, brother.